Hi, I'm Dr. Robin Brook. I'm a chiropractor in Manchester, New Hampshire. And I'd like to share with you an amazing story about a patient who came to me a few months ago.
This past August, I was up in the mountains with my family and we were swimming in a popular river area. And as I got out of the water, we were on some ledge. And as I went to come to a full stand, my feet slipped and I fell straight back, hitting the back of my head, which took the full impact of my fall. Initially, I felt fine, but my family was very concerned about me. So I went to a walk-in clinic, and the doctor discussed with me, possibly that I have a concussion, and I went through all the neurological testing, and I was fine. So I went home that night, and I had a little bit of nasal swelling and headaches. It happened on a Friday, but by Monday I kind of felt fine and went back to work. By Thursday, my work definitely started commenting that maybe I should go see my primary care doctor because I definitely wasn't myself. So I went to the emergency room and had a CAT scan, which came out normal. And the following week I went to see my primary care doctor. And again, we discussed, I had a concussion, and, it was a pretty severe concussion. So 2 weeks later, I went for a follow-up, and at that visit, I started to slur my speech. And I was having trouble walking. So he referred me to a neurologist. I went to the neurologist a few days later, and she felt it was the medication I was on. So I went through this process of, one thing after another of the doctors just not quite knowing what was wrong with me. At some point, I started physical therapy, occupational therapy, and all those movements and being in the car would bring my symptoms on. I would have slurred speech over and over again. And at one point I was diagnosed with anxiety, and it became very frustrating to me because I knew I didn't have anxiety, that there was something wrong, but we couldn't quite figure out exactly what it was. So at some point my brother had told me about Dr. Brook, and that he had found great success with some issues that he had that were more medical issues, but that coming to the chiropractor helped resolve some of his symptoms. So he had recommended for me to come in and see Dr. Brook.
So Deb came to the office, and it was quite apparent that she had some severe neurological symptoms going on. So I sat down with her and we did a thorough history. I did an examination and we took some x-rays. And even through the examination, she was not really functioning well. And so I did a really gentle chiropractic adjustment on her, and initially it re-triggered her symptoms. Yeah. Her speech got worse. She got up, her gait, she had this altered gait that it's hard to describe what it looked like, but if she touched one spot in her back, it would make her symptoms better. So she was hopeful that, well, maybe that's what chiropractic can do. If I can touch my back and it feels better, there's got to be a chance that a chiropractor can help me. So when I did the x-rays, surprisingly, her spine, there's some language called spinous process all along her spinal column that were all twisted to the right. That's not something that a chiropractor would normally see with a regular visit. So I knew something really severely happened to her. So we scheduled some follow-up visits, and she and I were both hopeful that I could help her. So she came back, I'd say, sometime the following week. And her symptoms continued. We did another adjustment. The treatment was, again, very gentle. I did it right up to her upper neck. I could not spend a lot of time on her because I did too much. It seemed like her symptoms got worse. She came back again, and surprisingly, she got better. She was starting to have better function. Her slurred speech improved. And then weeks into it, she continued to improve. We got about 6 visits.
So after the 6 visits, definitely it was remarkable for me. After 4 months of being at home and not being able to function well, and not being able to really go out into society because my body would just kind of break down. Just after those 6 visits, it was amazing to me that my slurred speech stopped. My gait was definitely, my walking definitely took a little longer, but even that, it was, amazing, the transformation. And I'll tell you honestly, I've never gone to a chiropractor before, so this wasn't something that I thought was the answer. And The medical community knew there was something wrong with me, but they really can't figure out exactly what it is. But I've had tremendous success coming to see Dr. Bruck, and I think that when I first thought about coming, I was worried because you think about chiropractors, and I always think it's like some very strong manipulation, and it's really not. You know what I mean? She's been very gentle, and but it's just amazing to me how much my body has responded and continues to respond each time I come in. And sometimes I have setbacks, but I can come in and literally by the end of that day, I'm kind of back on track again.
What I'd like to share now is Deb is back to work part-time, which is such a wonderful thing that she gets to experience again. She's back to work. She's back to somewhat functioning a normal life. We're still treating her, and it's going to take some time for her to have complete recovery. But I'd like to share the story with you, and hopefully that people out there who have not had great success with post-concussion syndrome, please seek out a chiropractor near you, and hopefully you'll have such good success like Deb also did.
At Chiropractic Associates, we are committed to the well-being of our patients, and we use safe, effective, and natural forms of treatment. If you feel you've been suffering from this particular condition, contact us so we can get you feeling better fast.